Chemotherapy and targeted therapy. A brief overview for those who are not familiar with these terms. Chemotherapy is a method of cancer treatment that involves the use of drugs that affect malignant cells and inhibit their growth and reproduction. Chemotherapy can be used as a standalone treatment method or in combination with other methods, such as surgical removal of the tumor or radiation therapy. Chemotherapy may be prescribed alongside other cancer treatments in the following cases: after surgery to destroy remaining cancer cells, to reduce the size of a tumor before surgery, in cases where cancer has spread to other organs or lymph nodes, to prevent cancer recurrence after the primary treatment. However, in some cases, chemotherapy may be the only treatment option, especially if the tumor cannot be surgically removed or has already spread to other organs. The chemotherapy process can vary depending on the type and stage of cancer. Typically, chemotherapy drugs are administered intravenously, allowing them to circulate throughout the body and reach tumors in various locations. However, sometimes chemotherapy can be administered in the form of tablets, capsules, or local injections. A course of chemotherapy typically includes several treatment sessions carried out at specific intervals. The duration of the course can vary depending on the type of cancer and the body's response to the treatment. Targeted chemotherapy is a cancer treatment method aimed at specific molecular targets that are present in cancer cells. This method is more precise concerning cancer cells and less harmful to healthy cells, allowing for better outcomes and reduced side effects. Targeted therapy is prescribed in cases where the tumor has specific molecular alterations or receptors. However, not all types of cancer respond to targeted therapy, and in some cases, its administration may be denied. This may be due to the absence of specific molecular changes in the cancer cells or the presence of contraindications for this treatment method. The implementation of targeted therapy may be contraindicated in the following cases. 1. Presence of additional molecular changes. It is possible that the tumor has several molecular alterations, and some of them may counteract the effectiveness of targeted therapy. For example, the tumor may have mutations in genes that activate alternative signaling pathways or cause drug resistance. 2. Presence of comorbidities. Certain medical conditions may be contraindications for administering targeted therapy. For instance, patients with heart problems may not be able to use certain medications that could lead to cardiac complications. 3. Unpredictable side effects. Targeted therapy may have side effects that can be dangerous or unpredictable. In such cases, patients at high risk of adverse side effects may be excluded from treatment. 4. Unavailability of the drug. Some targeted medications may be unavailable in certain countries or medical institutions due to restrictions on their use or high costs.